Our troubled economy is forcing more and more Americans to make a trade-off that can be very dangerous to their health. Now, according to a new Consumer Reports poll, almost half of Americans are delaying doctor visits and procedures or buying cheaper drugs from outside the U.S.
And for one breast cancer survivor, balancing finances and health is a choice that she, like so many Americans, would rather not have to make.
My name is Mia Baker. I was diagnosed with breast cancer in April of 2010 during a routine mammogram. Those words are crushing. Of course, the fear of cancer is huge, but also financially, cancer can be debilitating to a family. We have run the whole gamut of worries, of financial worries in this household. We went from people who could pay our bills, make our house payment, to people who couldn't make their house payment and couldn't pay their bills. On top of the economy declining and my being sick, I ended up having to close my business. We do put off going to the doctor. Prior to all of this happening, if the kids were sick, I would have rushed to the doctor. Now I wait to make sure that that they are really sick, that they're not going to get over it themselves. I wait a couple days. Having cancer, I could tell you 100 different pains that I have all over my body that I'd love to run to the doctor for, and because I'm scared that there's something going on, but I don't, because we can't create bills. It's a huge headache. It's a daily headache, but it's a new way of life. We've learned to adapt, and we've learned to live life differently because we had to. It's pretty hard to ask 12 and 13-year-old boys to be careful, but we do. We don't want any of those bills. I don't want to, be the mom who doesn't let them go do something, and live their lives. But yes, we have to be. Lily. We have to be careful right now. We're living on the edge. We're on a very fine line, and we have to get past this. And you almost wait for the next shoe to drop because you're so scared of what could happen then.
And joining us now is medical correspondent Dr. Jennifer Ashton. Doc, good to see you this morning. I mean, in these tough times, it's tough for families in good health to save money, let alone families with situations like this. What do you recommend for people how to stretch their dollars to make sure they can kind of appropriate money for all the different things they need?
Well, Chris, the obvious answer is for little things, stay healthy, because not just does your life depend on it, but your finances do as well. Absent that, people with chronic diseases, things like heart disease, cancer, there are big organizations as well as grassroots organizations that can help with patient support services, even coupons. You want to speak up, talk to your doctor, ask them about whether these things are available, and share your concerns. Be honest.
And this is so important because of this Consumer Reports survey that we mentioned, looking at the way Americans are dealing with this, and even with the prescriptions that they take every day, and they're taking a lot of risks.
Staggering numbers, Erica. 49% of Americans are on some type of prescription medication, and the average American doesn't just take one drug, they take 4.5 medications. So for people who are having trouble getting those medications, you want to ask your doctor if a generic is available, plan ahead for both medical and financial emergencies, and if you are having trouble, whatever you do, do not modify that regimen by yourself. People are cutting down on medications, using expired medications. It can be very dangerous. Speak up. Help might be available.
Even ordering from overseas, which you say can be dangerous too, because you're never clear what you're getting.
With shortages out there, it's another issue as well, correct?
That's right. And again, you want to try to ask your doctor ahead, what if my drug is not available, so you're not caught behind the 8 ball.
All right, Dr. Ashton, thanks. Good to see you here this morning.